Moving from the arteries into the capillaries, we have to look at the capillaries and the various different types of capillaries that are found in the body. Now, in general, capillaries are microscopic blood vessels. You wouldn't be able to see them if you're doing a dissection. You'd need to have a microscope to have any chance at finding them. But these capillaries are typically 1 cell layer thick for the tunica intima. That 1 cell layer thick is allowing for diffusion, allowing for ions and nutrients to pass through. So it's kind of important to make sure that you've dropped the blood pressure as well as slowed down the blood flow from those arterioles before you get to these capillaries. Otherwise, you'd rupture them. Now, you do have some helping support structures. These periocytes, they're meant to help stabilize the walls of the capillaries. Reason being is the capillary walls are 1 cell layer thick. They're so thin, they need some additional help sometimes. But they can also help with the permeability, allowing things to pass through or not allowing them to pass through by creating a solid structure. But this size, single red blood cell, that's it. Which means, and this is also why those red blood cells have to have that spectrum for the flexibility, because they can't fit through if this makes a turn and gets a little bit more on the narrow side. So the capillaries, found practically everywhere in your body, except a few main spots. If you think about, hold on, except where? Well, where is there no blood in the body? Cartilage doesn't have blood. Epithelial tissue doesn't have blood. So think back to histology. All those get their nutrients via diffusion coming in. You then also have the lens of the eye and the corneal layer of the eye. No blood supply in those structures. Diffusion, again, is occurring. So what is the purpose of a capillary? Really is exchange. Exchange anything and everything found within it. Now, the majority of what's exchanged here, gases, nutrients, hormones, waste product, ions. But certain capillaries can even exchange cells because they have large enough openings. It all depends on which capillary you're in. Now, the most common of the capillaries, the ones you typically think of as a capillary, is going to be this continuous capillary. They're abundant from head to foot. They're all over the place. The continuous capillaries have these tight junctions that help to hold things together, help to keep the cells in place. But they also have these intercellular clefts, which are little spaces in between some of the cells. Those intercellular clefts are allow for some of the small solutes, some of the fluid, to kind of exchange between the actual blood, which is inside the capillary, and the intracellular fluid, which is outside the capillary. So there is exchange occurring through the capillary walls. Now, when we look at the continuous capillaries of the brain, these are a very special set of capillaries because they're making the blood-brain barrier. So that blood-brain barrier might ring a bell back from AP1. It's meant to take the blood and modify it just a little bit so it's specialized for the brain as far as nutrients go. It also helps keep out a lot of unwanted particles. So we have this special blood-brain barrier, which is a continuous capillary. So here's what you look at for continuous capillary. The cells are pretty much solid all the way around. But you'll notice there are these intercellular clefts in between the actual cells. That allows for a little more exchange of the internal material for the external material. So looking at some liquids, some ions are traveling through those clefts. So continuous capillaries, probably the most common, head to foot. But two more we have to check out. We have what's called fenestrated capillaries. Now these fenestrated capillaries are going to have basically pores which are known as fenestrations. These pores are going to allow more permeability of this capillary. So the fenestrated capillaries are more permeable than the continuous capillaries, which means more things can flow in and out of these fenestrated capillaries. They're really meant to allow for more absorption of filtrates. So absorption or filtrate formation here. So you're looking at locations thinking about wherever you need to have more exchange occurring. You can see that all these little holes that are all over the place, those are the fenestrations or the pores. Those little tiny openings help us to increase permeability compared to the continuous. But this is only the second one. The third one is going to be sinusoidal capillaries. These sinusoidal capillaries have these large intercellular clefts. Now, these large intercellular clefts are great because larger things can fit through them. They also are a little bit larger than the other capillaries because their lumens are a little bit larger, allowing for more exchange of larger materials in and out. But they a lot of times also have fenestrations. But these actual sinusoidal openings are large enough to allow the actual blood cells to pass through. So we're talking openings large enough to have a cell go into and out of. If you're wondering, why would you want cells to leave the blood here? Look at the locations. Liver, bone marrow, spleen. All three of those locations are dealing with red blood cell, either storage or production. Same for white blood cells. So you're trying to make sure that the cells you're producing can get into the bloodstream. You're also then pulling out the old blood cells. So it's important to make sure that you're allowing the exchange of new and old cells at these locations. You're not going to have a ton of these sinusoidal capillaries throughout your entire body because you don't need that. You don't need this much permeability, allowing actual cells to move in your muscles, in your skin. No, so those ones are more continuous. These actual sinusoidal ones are really limited to where you need to have the cells exchanging back and forth. You can see there's these huge openings that are allowing different cells in and out. So these are your sinusoidal capillaries, the most permeable of the three types. So from continuous to fenestrated, now to sinusoidal capillaries. But now that we know the three different types of capillaries, we need to look at what an actual capillary bed is. This is what's between the arterial and eventually the venule. There are two main types here. We're going to have this vascular shunt. The vascular shunt is made up of a meta-arterial as well as this thoroughfare channel. It's pretty much a straight shot from the arterial to the venule. You're not going to do a lot of exchange of nutrients or gases. It's just trying to get from point A to point B as fast and as efficient as possible. This is your direct connection. You'll do this if you're not really needing to exchange any ions or nutrients or gases. Maybe you're going through a tissue and that tissue already has a full amount of nutrients and gases. Well, just simply get back out of there and head back to the heart. The other type are the true capillaries. And these true capillaries I have down here 10 to 100 exchanges. It varies depending on the actual capillary bed. But these true capillaries are branching off of the meta-arterial typically. They can come off of the terminal arterial too, but a lot of times off the meta-arterial. This is where the real true exchange is occurring. It's where most of the diffusion and absorption is happening. So if we look at this one, we'll see on the side here, this is your arterial. That's where the blood's coming from. This is the venule on the other side, blue. That's where the blood's going to. You'll notice this is the meta-arterial that leads right into the thoroughfare channel. That creates a direct pathway right into the venule. You'll do that again if you don't need to have a lot of exchange. Or maybe that this particular one is just simply bypassing through because the one next to it isn't going through full exchange. But if you go into the true capillaries, that's what these are up top and down below. That's where the exchange would primarily occur for gases, for nutrients, for ions, for hormones, for whatever. But those true capillaries are controlled by these precapillary sphincters. Now, these precapillary sphincters are controlling blood flow into the true capillaries themselves. And those are regulated a lot of times by local chemicals. You could have vasomotor nerves controlling it. The idea is your body will determine, hey, open up, allow the blood go in, or close down, keep the blood shunting right through to the venule. All determined by what that tissue needs at that moment. So your body's constantly monitoring. Do you need to go into all the vessels and exchange nutrients or gases or waste or ions or hormones? Or is that tissue all set and good to go, just bypass right on through? You're looking at the idea of the shunt versus the true capillaries there. So a little bit about capillaries, the different types, and how they're kind of structured and set up in your tissues.